Hello and welcome to the Dental Labcast. My name is Jenna.
My name is Andrea.
Please follow and subscribe to support our show and to make sure that you never miss an episode.
Welcome to the next episode of the Dental Labcast.
Hello and welcome. Today we've got Christina Worle. Christina, you work in prison dentistry, is that right?
Yeah, that's right, yeah.
Lovely.
In a women's prison.
That's brilliant. Can we start first with how you got into your career and then how you got into prison dentistry?
Yeah, so I actually think I had quite a lot of exposure to treating kind of vulnerable and maybe people that could be excluded from normal dentistry at dental school. So I went to Plymouth and that was a big part of the curriculum there. And I was always quite interested in treating people that were scared of the dentist. And I've always been interested in mental health. And I think then as you sort of follow those things and you get better at it, and I think more of those patients find you and you start to kind of work out that a big part of why people might be scared or why they might have mental health stuff is that they've kind of suffered all different things in their lives. And then that led me on a bit of a journey of learning about kind of trauma, addiction, like difficult life experiences. And I suppose the work really got going for me is 2 years after I'd qualified, then worked at Peninsula Dental Social Enterprise down in Plymouth. And part of my job there was to do a day a week of work that directly benefited the community. So I kind of ran a small community clinic there for people that had sort of suffered homelessness initially, and then lots of other organisations of people that had been traumatised. And that's where I got a lot of my experience and learned loads just from working with different organisations. And what I heard a lot of people say was the last time they'd seen a dentist was in prison. So I was kind of like, I guess there are dentists in prisons. And that's when I mentioned I'm a prison dentist, a lot of people are like, oh, I suppose, yeah, there are dentists in prisons. And that was my reaction as well. I was like, oh, okay. And then I met someone just completely by accident, another lady who worked in a prison. She worked in a man's prison. And I was like, oh, I'm kind of interested. Like, could I come and shadow you? So I went to shadow her for the day and I was like, oh, I could do this. This is like what I'm already doing, but just with more locked doors. And it was very similar patients, similar kind of people that are scared, like really scared of judgment. Maybe they've, had something bad happen to them. They've been homeless. And then I moved to Bristol a few years ago and the job came up at Eastwood Park, which is the prison that I work in, which is a women's prison. And I suppose I'd done a lot of work previously with women that had suffered kind of trauma and abuse, especially sexual abuse. And I was like, oh, it's like my dream job. So that's how I found my way to prison dentistry.
It's really interesting. I mean, I saw you at the weekend just gone at the DTS show and I was I nearly fell into all of these questions. I was like, no, save it for the podcast. Stop talking. Don't ask these questions yet.
She was very excited when I told her what you did, Christina. She's like, oh my God, I've got all these questions.
It's definitely a great, you get so many anecdotes for writing about it. It's much more interesting than just being a normal dentist.
Yeah, I mean, I suppose a lot of people don't think about the fact that there is dentists in prison. I think I said to you at the weekend with my mum being a nurse and she nearly went for a job in a prison as a prison nurse. And I was like, oh yeah, I never thought about dentistry in prison. People still need to get the teeth checked and still probably have accidents and things like that. And, so I was really, really excited to get this one on and just find out, dig a little bit more, find out about how it all works. So for you, what does a typical day look like then inside, in a prison?
I suppose it starts a little bit differently because you turn up to work and then you've got to go through the prison security. And obviously every prison is a bit different and they are different depending on the security category and between men and women. So women is slightly different. There's a lot less female prisoners, so you tend to get all the different categories in one prison. So there'll be some open prisoners, some that are higher security. But it starts, I'll go through, go in, I draw some keys for the prison, so I'll get to wear a fancy belt and pouch and keychain, which I still really enjoy. So I'll get that. And then some prisons you almost go through like airport style security. It's very similar, and sometimes they'll do additional searches. There'll be sniffers dogs, and then I'll go in. My nurse is much better at being on time than me, so she's normally there and is like set up. And the first bit that's a bit different, I would say, is everything's probably a little bit more flexible and on the day maybe than in general practice. So I work a Tuesday, Wednesday. So for example, like today, I first come in and I need to see, have there been any emergencies? So there's two different ways that patients will reach me. One is they would sort of send off a form saying, I want to see the dentist. And the other one is that other members of the prison team or the healthcare department would say, we've seen prisoner Jane Bloggs and she's got a really big swollen face, so we think she needs an urgent appointment. So I'll often get sort of quite a few of those in the morning, so I would have to quickly triage, book them in. I always have quite a few emergency slots. Also, sometimes the wings will phone down, so the prison wings will phone down and say, oh, this person hasn't been able to sleep because they're in really bad pain. That happened today. So then I sort of I'm going to book those in. And then our wonderful healthcare admin team, they've got to kind of balance everything because they have like a GP, some nurses, mental health. We actually had the podiatrist in today as well. So there's a lot of people with diabetes and they have like the diabetic foot care and me, and they all sort of have all of these patients on a big list and they're all in different cell blocks. So they have an officer that would go in because obviously the prisoners can't bring themselves over. They have to work out where they go first. So there's kind of that element of having to fit it in. So I'll have a list of patients that I want to see that morning. And I'll normally try and say this one is the most urgent. And this one, of course, then there's loads of other things like maybe this person is a bigger risk, so they can't be with this person. And they've got to work all of that out. And so then I can sort of not have anyone for a bit and then suddenly I'll have 3. So you're sort of but I quite like that. I'm quite used to that now. It almost takes some of the time pressure out of it. Like I've got as long as I've got, and then I'll sort of work through people and sort of do it. If something's quick, I'll probably see them first, and then I'll work through all my people.
So I guess it was quite strange then when you first
Yeah,
went
and then
into that.
I get like a bit of admin time because I have to follow the prison regime. Prisoners have to be like back in their cells by 12, and then they're unlocked again at 2, and they get lunch in that time. And they're quite strict on that, so I couldn't say suddenly. I mean, if you're running over, like you've had an extraction, obviously they are a bit lenient, but I couldn't say start something at 5 to 12 because that couldn't happen all the time. And then I have a bit of admin time because there's, again, a lot of this kind of urgent things. If anyone needs any medication, I have to prescribe it to them, all of that. So there's probably a bit more of an admin load for me and my nurse as well. Obviously, she helps with a lot of that. And then similar again in the afternoon, really. So
Interesting.
It's a bit more flexible, I would say.
So when you say people have emergencies, is that basically a case if they've got to wait though until the next morning to be able to see you?
So I am there 2 or 3 days a week. So it would be on those 2 or 3 days. Obviously there are paramedics and other people within the prison, and they have kind of algorithms that they'll use for, if someone had a very serious infection, then it might be that they have to go to hospital. They can prescribe antibiotics to someone if they think that's justified. But yeah, they can have a little bit of a wait to see me, which isn't ideal. So yeah, it's definitely one of the harder things to balance, is making sure you can see all the people that need urgent dental care.
So when you say they've got to fill out a form, can they book just like a normal checkup with yourself, or does it have to be for treatment or an emergency as such?
Everyone is on like a big waiting list. Unfortunately, the wait is quite long. And then they can have a normal checkup, absolutely. And then so they would wait and then they would see me. So for example, like my day is often a mixture of, I've got the urgent people, so that's often like abscesses, very severe pain. And then I'll have a mixture of new people, I'm doing a full assessment, and then people coming in for treatment.
So you have said before when we've been chatting about this, Christina, that obviously some people are only in there for a short period of time, some are in there longer. So what happens to those who were on the waiting list? Do they get referred to an outside practice if they're then leaving, or do they just have to sort of fend for themselves when they get out if they weren't lucky enough to get treatment with you?
Unfortunately, yeah, they would have to then sort of sort that for themselves when they leave again. And it's very difficult. And I think, we know of the challenges within NHS dentistry, and I think that makes it harder because there's a lot of people that don't have a dentist on the outside, and they're trying to get all of their work done when they're in the prison system. And I have had people ask me, like, how long do I have to be in prison for next time to get my dentures made? And you kind of think, oh, I don't want to answer that question. I don't go murder someone. Like, it's kind of, yeah, I think that's sort of a bit of a, and I work within NHS dentistry in a sort of leadership capacity, and I know some of the challenges, but you are very faced with it. And then sometimes you can sort of see, I can see how this would work. Like, I had a lady today, she's got her own regular dentist on the outside. She has gum disease. She came in. She was like, I normally have my cleans every 3 or 6 months, so I know I'm overdue one. So I checked her over and I was like, yeah, and we did the clean, and that's all she needs. So actually the system works very well when it's like that, but that's very much in the minority. Most people are these great long treatment plans, really.
I want to get onto later about technicians and labs and things, but first I just want to unravel a little bit more about your types of patients that you see. So, with you working in a prison that's women, what sort of dental problems are common for you to see?
I would say the full range. I have everyone, things from people who have got nothing wrong and just maybe want a checkup, to people who are, could even be in their 20s and they need all their teeth removed and full dentures. That more extreme end of the scale is sadly, I would say, more the norm. Like, a lot of people I see have had very difficult start in life, difficult things happen to them, problems with drugs, substance addiction, not being able to look after themselves, and it's taken a terrible toll on their teeth. So it's very common for me to sort of be seeing people with multiple abscesses, lots of very broken teeth. And I think the main thing people want is dentures, because their teeth, they can have something back in their mouth. As a lot of people are very ashamed of their teeth, very desperate to get more help.
Yeah, and it doesn't matter what's gone on in your life, does it? This is a very important
Yeah, absolutely.
aspect of your everyday life, and even relationships in prison, the way people perceive you, the way they treat you, the way you behave, and again, being able to eat, a decent
Absolutely.
meal as well.
Yeah. And I think I probably don't know my research well enough, but I think there was a study in Scottish prisons. It was with men, but it was along the lines of, people with a worse appearance to their teeth. They don't engage, they don't build relationships with people, they don't kind of engage in rehabilitation and stuff for mental health as much. And I think you can see that, really. Like, if you were ashamed of how you look, you wouldn't.
It's really sad, really, isn't it? in some cases. I had a little nosy about what you do. You're part of the Dentech charity as well, is that right?
Yeah, that's right. I'm one of the trustees.
Trustees. And I had a little nosy on there as well. And it mentioned on there about trauma-informed dentistry. Can you just explain what that is?
Sure. So there are lots of proper, I will say, dictionary definitions of trauma-informed, but I'm going to do a bit of a personal one for what it means for me. So I'm sorry if I don't, it's not the textbook one. But I suppose for me, trauma-informed means having an appreciation of what might have happened to somebody. And obviously they might not necessarily tell you, but knowing that anyone could have gone through some trauma that makes certain things more difficult for them. So that could be sort of mental health issues, or kind of, direct difficulties with how they might access your service. And then with that knowledge, it's sort of being patient-centered with that person, kind of avoiding re-traumatizing them when they use your service, and making adjustments so that they can get as good dental care as someone that hasn't experienced any trauma. So an example of that could be if somebody has experienced domestic violence, which is unfortunately, I think, over 60% of the women in prison have at some point. And especially if someone has maybe had like some choking or hands on their neck, they can first of all just feel very scared at the idea of having somebody come near that part of their mouth. It can be really triggering. It can make how they interact with dentistry very difficult. They can be quite defensive, almost quite angry, because like a wounded animal wants to defend itself. And it's kind of knowing almost knowing that, and when you're talking to the person, you're always trying to de-escalate. I'm almost thinking like, what's behind it? So I'm like, I've almost, the more stressed they are, the nicer I am in a way. And I try and be like very soothing, go at their pace, ask them. I always check, like I would do like an extra oral exam. And I always say, I'm going to touch you on your neck. Is that okay for me to do that? And sometimes people say, no, I don't want you to. And I'll say, that's fine. So, and sort of sometimes people might not want the chair all the way back because they might have had some abuse happen when they're led down.
It's a very vulnerable position to
Yeah,
be in, isn't it?
absolutely. But I would say sadly a lot of women I treat have kind of had some of those big, quite traumatic things happen to them. But I would say by far the most common is people have experienced shame and judgment from people in positions of authority, or maybe being like shrugged off or feeling like they don't matter. And that can make people very sensitive to that happening. So it's often people are really embarrassed, very defensive, and it's sort of trying to treat someone how you would want to be treated. It sounds kind of sad that you have to say that, doesn't it? And I think a lot of people, this just comes naturally, but then you do see some people and you think, "Oh, goodness, like I don't think I'd feel okay if that was me." And so that's really what sort of trauma informed. I went on a bit of a ramble there, but I kind of got my point across.
So I'm guessing it to build that trust then with those patients that's had difficult experiences with healthcare or authority and domestic abuse. I guess you just take things a bit slower and talk through the process with them. How do you deal with building that trust with those people?
Yeah, and it's hard. I mean, I get the same as, I think I get a little bit more time with my appointments. And if I know someone's very scared, I can sort of book longer. But for my emergency appointments, I get half an hour, which is the same as I would have when I worked on the outside as like the 111 dentist. But I think often it's quite small things. Like if you ask someone if they're scared and then you listen and validate the response, that automatically makes someone feel less scared. And it's lots of small things, I would say. I've worked in the prison for 3 years now, and I think I have like a reasonable reputation that I'm actually okay. I mean, I would say that because like prison is a funny place. So there's like loads of crazy rumors that I get paid like loads of money for taking people's teeth out and all this kind of thing. And so we sometimes have a bit of a laugh about that. I think everyone thinks I want to steal their teeth and somehow I'm making like millions out of this. And I'm like, I get paid whether I take your teeth out or not. But yeah, generally I think that, and so people kind of generally know I'm okay, and I think that does help. It's just lots of small things, but you're right, it does take time, and sometimes the time isn't available, but it's making sure that the patient knows that's not their fault as well. Like our system and there not being enough dentistry isn't that patient's fault.
Do you have to deal with any aggressive patients?
Yes, but I would say I've dealt with worse not in prison.
Fair enough.
So actually, like I would say I do come across quite a lot of quite mentally unwell patients. There are some people that can be, in having psychotic episodes and things, and sometimes it's not at the level where it's been necessarily picked up and treated yet. And I have had a few tricky ones like that. I think that there's something about psychosis maybe that does, like people have told me they've got extra teeth, or they've got teeth growing in their brain and this kind of thing. And then I'm a bit like, oh, okay. And often then I will liaise with my mental health colleagues for some of those things. But anyone who is, I would say, presenting a risk to staff will not be brought over to the dentist. Like the prison officers would risk manage that, or they would stay with the person all the time. Obviously, if someone has an emergency, they can't be denied healthcare and they're in pain. But if they know that someone's having a particularly bad day for whatever reason, they would bring them the next day or something like that.
Yeah. So have you seen dentistry or anything that you've done like really improve someone's confidence or quality of life after you've treated them
Yeah,
compared to how they were
massively.
before?
Yeah. So like, I would say often like the denture cases, definitely. Because, people might not have had front teeth for a long time. They might have had, their front teeth like knocked out in assault or by like a violent partner. And Not that I really think age makes a difference, but sometimes there are people that are younger than me, and I don't know why, but that always kind of really hits me. And they've sort of all got very broken, like, abscessed teeth, and I think this is why I love the job and I do it, is there's something so rewarding about meeting someone who has written their mouth and teeth off from ever looking nice. They're terrified of dentistry, and taking them through that process of, being ever to have the teeth out, like make the denture, and then them having it and getting used to it. And then kind of hearing positive reports from like other people around the prison. And sometimes they'll be excited because for some of the prisoners that are no longer sentenced, they have the opportunity, especially if they get open prisoner status, they can work, and they work in like some local organizations, like a sort of outside of the prison. And it's a really important, I think, rehabilitation step for some people. And some of them will be like, I've got my teeth now, so I can go and do that. Or actually, I would like my kids to come and visit now because they can see me with it. So I think, the stuff is really powerful for them.
I can imagine. How different is clinical dentistry outside of a prison compared to inside of it? And I'm coming from a point of you have to use different types of like medications. If you've got patients that have had a history of drug use, do you have to be careful with what sort of, I don't know, anesthetics or anything you might need? Is there anything different at that end?
No, not really. I can do everything. So we're an NHS dental surgery, and we can do everything that you can do on the outside of an NHS practice that you can on the inside. So I've got all the same stuff, and so clinically it's the same. And actually, because you also see those patients on the outside, so yes, I would say probably I use more local anaesthetic. I do think my population might be a bit harder to numb up, but also they're all very scared, so it could be just more than that. So yeah, not really any different, to be honest, in terms of the actual clinical stuff I'm doing. Yeah. Maybe the treatment planning slightly. Did you want me to talk a bit more about that side of it?
Treatment planning, yeah. Do you have to do that differently inside
I
compared?
would
Because obviously it's
say
different environment.
it's more about the actual treatment plan would be the same. Like this is a diagnosis, this is what the person needs. But the constraint is the time. So it's how long they're going to be in the prison for. And sometimes we don't, the person doesn't know. Like they might be on remand, they might be going through a court case. I feel like I've learned lots about the criminal justice system in terms of like sometimes they can get parole, and so they could be released then. Sometimes they get released on tag. So sometimes they go earlier. There was this whole thing where they kind of, if you had done certain crimes and you'd served so long, you would go after this time. And sometimes it's constantly changing. So I think I've got like a year with the person then. Suddenly they're like, oh, I'm going in 2 weeks. And you're like, oh. So it's kind of discussing with the patient, like, what do we really want to get done? And if there's no chance of getting you that denture, who could we signpost to you on the outside? Can we get your mouth ready? Sometimes it's, so for example, I had this today. I'm treating a lady with she has a lot of teeth that need to come out. She has missing upper central incisors, needs loads of fillings. There's a lot going on. I think I've seen her for like multiple emergency appointments and taking teeth out here and there, and then finally got to see her do a full assessment, all that kind of thing. We'd done a quadrant of extractions and fillings, and she was in today for the other quadrant on the upper. Obviously, we're working towards getting her an upper denture because that's what she really wants, because she's got no front teeth. And she came in and said, oh, I've just been approved to go out on tag, or something's changed with my case. I can't remember what it was. So I think I'm only going to have 3 more weeks. And I was like, oh God. And she was like, please, please, please get me some front teeth. And I was kind of like, okay, that's just enough time. So she needed a filling on her upper left incisors. So we did that, and we took the molds, and we've agreed we'll do it as an immediate denture. So, it's very much not perfect. She's still got teeth in her head that need to come out, and she knows that those can cause her pain. But actually, it's kind of easier on the outside to get an appointment for an urgent dentist and a tooth out. But she will hopefully, if all goes to plan, will fit that denture, so she'll go out with some teeth, which will hope make her feel better. So it's kind of things like that. Like suddenly your whole plan can change. Or quite often I think I'll have more time and someone's like, oh, my release date has been moved for whatever reason. I have to skip the try-in or something, which, it's always a compromise, but I discuss that with the patient, and I do think sometimes my lab are like, what is this dentist doing? Like they don't know. I'm in a prison, they don't know why. The flip side is also true though, because sometimes I will get halfway through something and somebody goes, but then very sadly, quite often the person may come back in because sometimes the reasons that they've been committing crime has not been solved in their life, and I don't know how much support they got on the outside. So I never ever throw away special trays. If I've had special trays made for somebody, I never throw them away because who knows when you're gonna need them again. So sometimes I'll slowly get a treatment plan done for someone over like an extended period of time.
Talking of labs then, so let's get into the laboratory side and technicians. You did mention there that did you say your lab doesn't know that you work in prison dentistry?
Well, they know I work in prison dentistry, yeah.
So how does that relationship work then? Did they know when you first? Have you always used the same lab?
I used one lab, and then I think it was 2 gentlemen, they retired, so I used a new one. So I phoned up who I work with, and we had a nice chat. So I did kind of say like, I'm going to send you some things, and you're going to be like, what are you doing? But this is why. But they work with a few prisons, so they do know. I don't necessarily know the individual people that do the work because it's quite a big lab, but I do like to try, and unfortunately they're quite far away, otherwise I would go and say hi. But yeah, so that's kind of that side of it. But yeah, I always wonder because like those dentures, I always want to write them like a little note being like, I promise I'm not a rubbish dentist if she's leaving the prison and I know that these teeth need to come out, but this is why. But sometimes I do send them long emails. I don't know if they appreciate it.
With the communication between yourself and the lab and them being vulnerable patients, I know data protection and things like that is always a must. But with the clinical prescriptions, do they need to be more detailed given that the type of work that you're in?
No, I don't think so.
Is it just the same
It's the same,
lab
pretty
prescription?
much, yeah.
Not we might have to miss a few steps, miss a few.
If there's anything, like I would email them or phone them maybe, or I do like send them a little post-it note essay sometimes if there's anything funny. But yeah, I would say I would do that on the outside anyway for unusual cases. So
what type of restorative cases do you find? Like, what's the most complex things you tend to find you're sending to your lab?
I do a lot of, probably nothing that complex to be honest, because by the nature of it, I do a lot of acrylic dentures. I did get excited because one time I thought I was going to get to make a cobalt chrome, as I haven't done that for a while, but then the lady decided she didn't want it, and I was sad. I don't get to do crowns that often, so it feels a really fancy day when I do a crown. So that's fun. It's nothing really that complicated. I suppose sometimes the dentures are like sort of. Some people would, I suppose, might class full falls as complicated now because I don't do them that much, but I probably do them more than most.
It depends on what you do regular anyway, doesn't it?
Yeah.
What's complicated for one person is just bread and butter for another person, isn't it?
I don't think my lab works very sexy, just because of the nature of the patient.
I'm sure the patients disagree.
Yeah.
I mean, as long as it's functional and it fits and it's comfy,
I would say function,
is
the most important thing. But often it improves someone's appearance so much without doing anything, I would say, particularly fancy.
And gives
even
them their
just
smile
restoring
back.
the shape of the face.
Absolutely. Yeah.
So with you having patients that don't really know when they're leaving, you say some are leaving, you think they're going to be there in a year and they're like, oh, I'm leaving in 2 weeks. How do you manage those? What happens if you're halfway through a treatment with a patient? Because obviously you have to go back and forth to the lab, don't you? Especially if it's dentures, it's not just a one appointment kind of thing. So how do you manage that?
That is actually another interesting thing just to mention is obviously I've got my lab turnaround time, which is similar to on the outside, but then because it's a prison, they have to search the work coming in and out. So it adds like an extra week onto my turnaround time. So it might come to the prison in that time. So I've got a longer time between my appointments anyway. And for things like additions and repairs, it's so annoying because you can't do it. It's like pretty much 2 weeks. So that's frustrating. I think I always try, and if I'm planning a denture, I will know as much as I can when someone's leaving, and I'll try and plan it back. And sometimes I won't start, especially if it's, like a full, where I'm not going to skip the stages. And, I'll be like, I'm really, really sorry. Like, I just can't make it in time. As I said, sometimes you know if someone's perhaps been in and out quite a lot, and maybe then I might take primary impressions and get second and bite, because it might be helpful.
You don't actually say to them, I'll save this for when you come
No,
back.
you don't say that, but sometimes you do that, and sometimes that's very helpful. I guess there's times where I will have a discussion with the patient and I might have to skip the try-in. I'll say, the only way we're going to get this denture is if we don't do a try-in. And, that could mean that it's not going to fit. It might not look how you want. You might need to get it remade, but it's the only way we'll get you one. And most of the time they say yes. And I would say most of the time it's okay.
I mean, I suppose you're managing their expectations as well, aren't you? You're giving them the circumstances of this may not happen, that might not happen, it might be like this, and they're aware of that. So if they still go ahead, they know that, those are the risks that come with it. Have you been halfway through a treatment with a patient and they've just left, and how does that work with the lab if they've already kind of in the process of making that?
So they would obviously still get paid for each bit that they do. I think they probably don't necessarily know, because they'll send the work back to me, and then we store everything we've got, because we don't necessarily know when someone's going to come back. Sometimes, obviously, the other thing that happens is people aren't necessarily released, but they might move prison. So we will quite often send lab work on to another prison, or I've had someone sent to me where dentist is halfway through, they're at try-in, so I've been sent the try-in so that I can carry on. If someone has a dentist on the outside, I will always happily send the work. Sometimes if a denture is finished, I will send it to a patient, but I always think that's quite tricky, because we've had an instance of sending the denture out to the patient's address that they've given us, and then the patient is back in prison 2 weeks later and they want their denture, and that was their ex-boyfriend's house and you don't have it. So I think that can be hard. And also a lot of the time they need a dentist to fit it, and they might not have one, and probably they can't just take it to another dentist. So I try and avoid that if I can.
Yeah. Do you find other dentists would fit it if they did have that option, or are they quite funny about fitting a denture that's been made elsewhere?
I actually have never known, because I haven't had that instance. I would say have a really good relationship with the Cardiff Inclusion Service. So that's the community dental services in Cardiff, and they're amazing. And they are set up with the similar patients in mind, and I can refer patients to them and send lab work to them. I mean, they might just throw it in the bin and start again and not tell me, but hopefully they don't. So yeah, and vice versa. So that's really good, and it always makes me feel better, and I can tell the patient that that's what I've done as well, which is nice.
How do you go about picking? Do you pick shades for patients, and how do you work with your technician on that then?
I would say
it's just you pick the shade and send it, or
I pick the shade and send it. I've got I can't remember the brand of whatever denture teeth I use. I've got the shade guide. I mean, it's like a Vita shade guide, right? Yeah. I'm probably quite basic, but I do it with that, and it works. It works pretty well, and I just communicate it that way. I would say where I am quite limited is you're not allowed cameras and things like that, so I can't really send pictures, and I really miss being able to do that.
That's interesting.
Because also sometimes in my previous job, I would take a picture after and send it to the technician and say thank you, especially if it's because I think they don't know the story, they don't know the meaning of what this has meant to the patient, and I think it's really nice to be able to do that. I had one lady ages ago, this is not in prison, who she wasn't really going out, and she'd suffered really severe domestic abuse, and she was really scared of the dentist. Initially she was asking for all her teeth out because she couldn't cope, but she didn't need them all out. And we'd kind of coached her through it, and we made her she had all her lower incisors missing, and on the upper she'd had one tooth that was hanging down very low, very loose. And then so she'd had a denture on the bottom and that tooth out, and that replaced with a denture because she had some other missing top teeth. And considering she couldn't even open her mouth to let me look without gagging at the beginning, she was able to have like denture impressions, or like without, she didn't have sedation or anesthetic or anything, and have the tooth out. And then she had this denture, and she was able to go to her like daughter's baby shower, and she was like going out and all of this. And I just think like I'm kind of the lucky one in surgery. I get like all the lovely feels from these cases, so I do want to try and share that.
And you say you take impressions. I'm guessing you've got no digital scanners in prison.
No, I don't. I went to, obviously I met you guys, didn't I, at the dental show in Birmingham this weekend, and I was jealously looking at all the fancy scanners and all the fancy things. But I think digital scanners, or even just the ability to have the denture or the models stored as a digital image, would be so helpful for prison dentistry. And I know there's been some recent study in care homes, so that if someone loses a denture, it can be reprinted. And things like that would be so helpful because, often, like, I've had crazy things happen, like people will steal other people's teeth in prison, and I don't know why, but it just happens. And so then sometimes I've just made a denture and someone's broken it, or they've been out on a bit of a substance bender and they've lost their denture and they've come back, and it would just be so nice to be able to just print a new one for them, or go to just a try-in rather than start again.
It would be easier just to get a nicer duplicate of that, because it's not as simple doing it the analog way, is it?
Yeah.
Having said that, though, we've had to go old school at work today because my printer's died.
No.
I've had like a critical failure about 3 aspects of it. Yeah, I'm struggling to get the support team
Not
to
what you
actually
want.
be able to get it up and running. Yeah, it was like the nurse came in and she's like, "Oh my God, that was brilliant. I haven't done it for ages. I really missed that."
Yeah, but then if it went back to, you need to do this all the time, it'd be, I'm not doing that all the time. I'm
the
not
amount of
doing
times
that.
I used to come in going, "My arm's killing. I've done that much mixing today." But then today they're like, "Oh my God, it was so exciting. I got to do an analog impression again."
Bit of nostalgia.
Yeah. I'm like, don't get used to it.
How do your technicians contact you if they've got any issues, the lab or anything?
Mostly on email, because obviously being in a prison, you can't have your mobile phone.
Yeah.
We do have a landline phone in the prison surgery. I don't actually know. I haven't ever phoned it myself, I have to say. I think you can just fairly easily get through.
Don't know the number.
Yeah, but obviously sometimes when you've got a patient, we wouldn't pick it up.
Yeah.
But I would phone them on that, so I can phone out mostly by email. Sometimes I've given them a call on my mobile, like if it's something. But obviously then I can't see their records. It's kind of
it makes
same.
it slightly difficult then, doesn't it, for the communication between you, because of the type of work that you do. There's the barriers that's in the way from having that really good communication relationship. Like, you can't send photos, and they can't just ring you up and say, have you got this, or we need to do that, or this isn't happening, and we need. I mean, do the lab always manage to meet your timelines for things?
Generally, yeah.
Yeah.
I would say we've had a couple of. I mean, I've been there 3 years. There's a few things that go wrong.
Yeah, because I'm just coming from my thing. Sometimes you can have a case, and they're finishing it and just putting the final touches on something, and then it goes wrong. Say if it's a denture, for instance, they could be on the lathe polishing it up, and it whips out the hand, shatters into pieces or something. And
we've all been there, haven't we?
That was supposed to be posted out today, and now I've got to ring them. So I mean, I'm just thinking from that aspect of things that.
I haven't really had that. Or if they have, they've made a new one very quickly and haven't told me.
I feel like the way Andrea's laughing, that this has happened too often.
Is that like the lab equivalent of when you've done like a beautiful amalgam and you take the matrix band off and it like comes off with the band?
Yeah.
No.
Yeah.
Yeah. I think the one that's most commonly happened, I will say, is that I think the lab do work for actually this was the older lab we work with, but numerous prisons, and sometimes the wrong work has gone to the wrong prison, especially because quite a lot of the names are similar. So I will say that has happened, but we've always normally kind of sorted it out. And the other really common one is because it's mostly done by post, is that I've had like breakages and had to like retake. Like I had a try and arrived that was kind of break. That's more the post, I suppose, though.
Yeah. Or
But
they
not
lose
that
it in the
often.
post.
Yeah. Yeah.
Do you have to use particular labs, or can you just, say if you wanted to change your lab or anything, can you just ring up and pick your own lab that you want to it, or is there, are they on a list of approved labs that you can use?
It's approved, but it's mostly because of the lab fees are paid by the prison. So they need to be like on their invoicing system. And I think if I was to use, so I've got like a prosthetics and then a crown and bridge lab that I use. I think, yeah. So no,
And
I am a little.
do you do anything complex like implants or anything like that, or is it
No.
just standard crowns,
Because
dentures,
it's what's available on the
bridges?
NHS. So yeah.
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 I mean, I must admit, I did think when you was talking about a chrome, I wasn't sure if that would be allowed in a prison, because there's a lot of things that can be weaponized, aren't they? And you
Well,
can't,
that's interesting. Never thought of that. Yeah.
you know.
Just take all the acrylic off. Or,
Yeah,
I
and
mean, I
even if
suppose they
they've
could
got rests and
actually,
stuff like
and
that, I mean, you can cause a lot of damage.
see how dark our minds go, can't you? Like, just
That's
sharpen up
true.
the acrylic there.
I mean, some might come in with them, so they're
Yeah.
not
Oh,
an uncommon appliance,
I
are
think
they?
they
But
take quite a risk-based approach to it. I think if this person was threatening people with a denture, they'd probably take it away. But I guess it's kind of, I've never come across that.
this is a rabbit hole we didn't think we were
Yeah.
going to go down, isn't it?
I
oh,
have
brilliant.
had a lady who had a lower acrylic denture with clasp, and she was using the clasps to self-harm.
Oh,
So
right. Okay.
actually, I
Yeah.
have had things like that. But that they're allowed types of razors. They have vapes to shave. Like you can't,
Okay.
like there are some people where they're a risk to themselves or others, and they have to have all these things taken away. But I think, yeah. Weirdly, we're not allowed teepees in the prison because of the wire. So there are a few weird
Okay.
things you can't have. They can't have floss. Ordinary. They can have floss sticks, but they can't, because they
Yeah.
can use it to tie like ligatures with.
Yeah.
There
And
are
there's a
like
lot,
lots
lot
of
of
controls.
considerations, isn't there, have to go into these sort of things. So,
Yeah. Like as a member of staff in the prison, you can't have metal cutlery. You have to take only plastic
yeah.
cutlery in for obvious
How would it work
reasons.
with toothbrushes then? Like, I mean, I suppose you could still sharpen the end of a toothbrush on something and
Probably
use that as a weapon.
I haven't come across that, but I mean, though, yeah.
You'd have to have something sharp to sharpen it up with first.
Well, I'm just
I
thinking you
think
can sharpen things on brick walls and stuff,
some of
can't
the
you?
stuff you hear about is
Yeah.
ingenious, I will
Yeah.
say. Some of the different things people get up to.
Have
Probably
you got
not
any
worth
that you
sharing
can
on here.
share? No?
I probably can't on here.
No.
There was one lady who had a drinks can and had kind of bent it into a weapon.
Yeah.
And
I
that,
mean, if people want to do something
They'll
and
find a
make
way,
yeah.
won't they?
Yeah, exactly.
Yeah.
But that all kicked off outside the dental surgery door, so we kind of shut the door and there was all this scuffling going on. But
God.
if somebody rings a panic alarm, a lot of prison officers come quickly.
Are the prisoners allowed to come in and see you without a prison officer, or do they have to be escorted
They're
in
all
and they wait
escorted
there?
over. It depends. Most of the time, they wouldn't have a prison officer in the room with them. I would say a lot of the women are not in prison for violent crime. And there's a statistic that women in prison have often been the victim of a much more violent crime than the one they're in prison for. So, anyone who could be a risk to me or needs to be kept watching all the time, yes, the prison officer would, of course, come in. But that's quite rare.
Has doing this sort of work changed your perspective on people or society in any way?
Yes, I would say it has. I think you do realise how lucky you are, but also how close we could be to some of these really difficult stuff happening to us. and that can be quite unsettling. I do also think is it really bad that it's made me a bit less trustful, I think, because some people I get on really well and I'm like, this lady seems lovely. What can she be in prison for? You find out she's murdered someone or something. And sometimes you just never know. And that's kind of, I think it has made me a little bit more
Weary.
yeah, maybe.
Yeah.
I don't know if I like that, but I think that's just the yeah, I like the job because it does make you think kind of ethical questions and question lots of things.
Yeah.
Sort of
So
interesting.
what's the most rewarding part of what you do then?
I think it's tied between sort of what I was saying before, those cases where you're sort of really giving someone back those teeth. I really do like working with people that are quite scared or phobic of the dentist. And I've had one person who I think I've probably seen them 3 or 4 times, and they've had really big abscesses and they need a lot of teeth out, but they've never had any of the teeth out. They've always refused. And then quite recently they were like, okay, and they came in and they had like 3 teeth out. And I think so it's even that, even if you don't necessarily think you've gotten anywhere in that appointment, like over that relationship, he kind of
That's a good win. That's a
yeah.
good win.
Yeah.
Yeah, and then they know that they can have that again. So I think that side is very rewarding. Or when people are really scared and they'll say, "Oh, I didn't even feel anything," or like, "Oh, that really wasn't that bad." And I think, especially when people are really proud of
Yeah.
themselves for having something done, I think that's a really nice
Yeah.
feeling.
But that's definitely rewarding, isn't
Yeah,
it?
definitely.
Yeah. Warm feeling inside.
Yeah.
From
Definitely.
that, have you got any patient cases that stayed with you that you just can't seem to get out your mind?
Probably that one I just shared with you,
Yeah.
that sort of person who recently had teeth out. I can't really share too much just because I think some of the reasons they've stayed with me are probably for reasons that might make someone might recognize themselves or someone might, I don't know. But
Yeah.
yeah, I think sometimes some of the cases where different things have happened to people and it makes you very sad, those ones do kind of stay with you, definitely. Um, and some of those things. Yeah, I think sometimes you realize that life can be quite cruel to people. And sorry, I'm being a bit of
Yeah.
a downer now, but like I think that
No, no.
can be the sad part of working in there. And sometimes you do hear some of those things. Yeah, and I
I
So
think
what
you're
often
seeing the human, aren't you, behind it? Because people all see people in prison and they see the crime,
yeah.
and you're actually seeing the human behind that and
yeah,
understanding how they potentially ended up there, what they'd gone through, and as you said earlier, that they're pretty much a victim,
absolutely.
really. And they've just sort of
Yeah,
reacted or responded and ended up in prison when technically they should have been protected
yeah.
from that situation in the first place.
There's one lady that I did see. She was sort of in and out quite a lot over about a year. And she'd had some really difficult things happen to her, and she sort of, over the time I knew her, would sort of chat a bit about it. Um, and she was really scared, and she'd always she got on really well with one of the receptionists in like the healthcare department, and she was very scared, and she wouldn't. I think, to be honest, she just really needed a mum, and she'd get this lady to come in with her and always hold her hand while we like got her numb and took the teeth out. And she got sort of funding for a rehab placement, and she was really excited to go. And I haven't seen her again, so I always think sometimes those
Oh,
people,
that's
she
good.
hasn't come back, and so I'm just hoping and praying that she's somewhere doing well. So I think those ones do stay with you when you've perhaps formed a bit more of that relationship with.
Yeah, that's going off the back of what Andrea's just said. People don't. You look at the fact that they're in prison, but some of these are not in prison for actually doing anything bad. Some of them have just, like you say, they probably had drug use and just made a silly decision or something.
Yeah. And
Sorry,
yeah, and I think there's quite a number of women that sounds crazy, choose to be in prison. And actually, I think when you think about it, like if I was a street homeless woman and it's winter, probably I'd much rather be there. You have a bed, it's warm, you get meals, you get healthcare, and you actually they have quite a community in there, like their friends are there, and people will, I have one lady set a bin on fire outside a police station, so she was arrested, and arson carries a longer sentence, and that's what she'd done.
do you think some people purposely want to put themselves back into
Absolutely.
prison
Absolutely. Yeah,
more
yeah.
for a safety net? I think
Yeah.
because they're so used to being
It's
inside.
their home.
Or it's yeah,
Yeah. Yeah.
I have actually had a conversation with someone I know quite well who was in and out of prison throughout most of their childhood and a lot of their adult life. And I remember saying to them, one time, what's the attraction? With you keep going back, you're obviously a really bad criminal because you keep going, you keep getting caught and going back. What's the attraction? You must be doing on purpose. And he says, "Well, all my friends are there." He said, "That's my life." That was his, as you've just said, that was his home, that was his life, that's where his friends were, that's where he felt safe and warm and cared for. Yes, he said it was a dangerous place to be, but if you knew the rules and you had your place within that hierarchy, within there, that was your home, that was your life. It's hard for people to deal with the outside world when they can go inside and not really have to even think for themselves. They just follow a routine and it's safe. And if some of them's been in particularly dangerous situations that Christina's seen, they're probably a lot safer inside than they would be out as well.
Yeah.
It's a refuge, isn't it?
Mm. Yeah. I talk for hours.
Anyway,
I'm just going to go back. I'm just going to go back quickly to technicians. I'm quite surprised that working in prison dentistry that you don't kind of have an on-site technician
I would love
with
an
you,
on-site
but
technician. That'd be
um,
amazing.
maybe that's something that might come in the future. You never know.
Sometimes I have a daydream, okay, that like somebody, like maybe Andrea, like I'm just gonna throw this project to her, like someone sets up like a little dental lab in there, and then like because the women can learn things, so there's like they can be like with the building department or the gardens, or there's like a nail and beauty. So they can do an apprenticeship in that. I'm like, they could do like apprenticeships for some of like lab technician stuff. I'd be like, so cool.
yeah,
They'd all be
they
making
could,
themselves crazy dentures, so I don't know quite how that would work. But like, yeah, it'd be great.
They've been making grills,
Yeah.
probably.
I also feel like
Yeah.
I mean, I've only got one tiny little dental surgery, but I'm only there a couple of days. There would be, huge application for like a clinical dental technician to make loads of dentures, and that would take loads off of my plate. I don't think we use clinical dental technicians well, or at all, in the NHS. So that would be
No.
amazing.
Yeah.
No,
That's surprising.
even within the hospitals and generally within the NHS, there's very few actual clinic. They are starting to creep in a little bit now, but like you say, they're not really utilised or employed
It's a
properly.
shame because
also
they really need to
Yeah.
be, don't they? Because they're amazing clinical dental technicians.
Yeah.
What
I
they
should
can
also
do.
just say that I haven't acknowledged this. I also work with an absolutely amazing dental therapist who is called Freya, and she's getting married soon. So congratulations, Freya. But so it's not just me. Like, and she does absolutely tons, and she's absolutely amazing. So
Is she within the prison as well? Is
yes,
she
yeah.
full
So
time, part time?
she does like 1 day a week. So there's me 2 days, and then she's there. And she's fabulous because she will also do some direct access. So a lot of the time she can do checkups within her scope for people, which is kind of fab, especially we've got longer sort of serving prisoners.
Is that very useful for you as well?
Because obviously I get so tied up in a lot of the urgent stuff.
Yeah.
And sometimes if I'll say see an urgent patient and maybe most of their teeth look fine, but they had like pericoronitis of a wisdom tooth, so they see me for that, then sometimes I will mark, would be good for a direct access exam, because then she can obviously anything that she thinks, oh, I don't like that, she'll send it back to me. But there's so much caries there that I think she loves it. She gets to do loads of fillings. yeah.
I do tend to find some therapists that I know they love getting in there and doing these fill-ins and things, which is great because I feel like, no disrespect to any dentist or anything like that, but I just feel like with this scope of practice, they really want to get in there and do more and help out more as well, which can then take the pressure off yourselves to do
Absolutely.
the more complex things that you need to do.
I did have a conversation with the dentist once. I was at, I think, the Dental Leadership Network event in London, and we were sat around a table and we was all just chatting. And I don't think they realised I was a technician at first. So I'm sat there and I was like making some quite naive statements about stuff. And one of them was about utilising the entire team better, because dentistry is struggling so much and patients are struggling to access it. If we utilize the team more effectively, it's going to be much better for everybody. So I says, the dentist can do the more complex stuff and then refer the other things out to other team members. And this dentist got a little bit shirty with me about that. And I says, okay. She says, we actually enjoy doing some of the simple things. She says, can you imagine how stressful it would be for us if all we did was the complex, hard stuff? She says, we actually enjoy doing some of that more simple stuff. It's like a little bit of a respite from the complex stuff. And I just went, oh, okay. I mean, I sort of saw a point a little bit, but then on the other hand,
Like, everyone loves a really juicy scale and polish, right? sometimes when I'll see someone, especially if they're a new patient and maybe that's what they need, sometimes I will do the scale and I'm like, sorry, Freya, I did the scale. But there's more than enough to go around for us, so
Well, this is it. There's
Yeah.
plenty
I don't
of
think
work,
anyone's
isn't
going to
there?
run out, are they?
No,
Yeah.
there's plenty of work for people out there to.
And I do a lot that's a quadrant because I'm doing so much. So I'll do, the scale, the fillings, and the extractions, because that just works better for that quadrant if they need everything. But there's still absolutely tons of fillings for Freya to do. And I would be very happy if she was like, all I have is perio on my list and I don't want to do only perio. I would do some. I would say I'm lucky I know her on the outside and we've got a really good, we're friends and we sort of worked together somewhere else before. So we've got a really good relationship and trust each other a lot. So sometimes I've sent her something and she will just send it back and being like, I think those are for you, don't you? And I'm like, oh yeah, sorry.
Nice try, Christina.
Yeah.
Nice try.
You're having that one back.
Yeah. And it's fine.
Have you got any messages that you'd like listeners to, especially dentists and technicians, to take away from the conversation that we've had today?
Say be open-minded about what people have been through. Because you never know, especially if someone's scared of the dentist, there's normally always a reason. I would say for technicians, you're all amazing and you do really cool stuff.
Oh, what a fabulous message to
Thank
end
you.
on.
No, the last thing, this is just the last thing I am.
Come and set up a lab in Eastwood Park, please.
Before we do finish, what is it that actually keeps you motivated in such emotionally demanding work?
I think it is the meaning you get from helping people and that side of it. And especially when it's people that maybe they haven't had the help they should have before. That I think I get a lot of meaning from my job. And yes, it is very emotionally demanding, but I think it's very emotionally rewarding to balance it out.
I think that's a good thing to end on, really, don't you?
Perfect.
It's been an absolute
Absolutely.
pleasure talking to you, and I've found it very insightful. I think it's brilliant what you do.
Thank you.
And thank you for
you
coming on
very
and joining
much.
us today.
Thank
Really
you so
appreciate
much.
it.
Been
welcome.
amazing. Thank you.
Take care.
Bye.